Gastroesophageal reflux disease or GERD. What to know? Gastroesophageal reflux disease or GERD is a long-term condition where acid from the stomach comes up into the esophagus. Many people occasionally experience gastroesophageal reflux or GER. However, if an individual experiences persistent acid reflux that occurs more than twice a week, they may be diagnosed with GERD. In other words, GERD is the long-term regular occurrence of GER. What is GERD? Gastroesophageal reflux disease is a condition where stomach acid persistently and regularly flows up into the esophagus. The esophagus may also be referred to as the food pipe or gullet and is the tube that transports food from the mouth to the stomach. The acid in the esophagus causes heartburn and other symptoms, as well as possible tissue damage. The American College of Gastroenterology says that at least 15 million Americans, or 20% of the American population, experience heartburn every day. Causes. Occasional acid reflux is quite common, often occurring as a result of overeating, lying down after eating, or eating particular foods. However, recurrent acid reflux diagnosed as GERD typically has other causes and risk factors and can have more serious complications. Gastroesophageal reflux disease occurs in people of all ages and sometimes for unknown reasons. In short, GERD occurs when the sphincter at the bottom of the esophagus becomes weak or opens when it should not. GERD occurs more commonly in people who are overweight or obese because of increased pressure on the abdomen, pregnant due to the same increased pressure, taking certain medications including some asthma medications, calcium channel blockers, antihistamines, sedatives and antidepressants, smoking and being exposed to second-hand smoke. Hiatal hernia is a condition where an opening in the diaphragm lets the top of the stomach move up into the chest. This lowers the pressure in the esophageal sphincter and raises the risk of GERD. Symptoms. The main symptom of GERD is heartburn. Heartburn is discomfort felt behind the breastbone as a burning sensation. It tends to get worse if the person lies down or bends over, and also after eating food. However, not all people with GERD experience heartburn, and there are other possible symptoms: nausea or vomiting, bad breath, respiratory problems, difficulty or pain when swallowing, decay. Complications. GERD can worsen and turn into other conditions if left untreated. This include esophagitis. This is an inflammation of the esophagus. Esophageal stricture. This is a condition the esophagus becomes narrow, making it difficult to swallow. Barrett's esophagus. The cells lining the esophagus can change into cells similar to the lining of the intestine. This can develop into cancer. Respiratory problems. It is possible to breathe stomach acid into the lungs, which can cause a range of problems including chest congestion, hoarseness, asthma, laryngitis and pneumonia. Prevention. Other lifestyle and behavior changes can help relieve GERD, include Eat moderate amounts of food and avoid overeating. Stop eating 2 to 3 hours before sleeping. Quit or avoid smoking. If a person is overweight, losing weight can help prevent symptoms. Do not wear clothing that is tight around the abdomen. Sleep at a slight angle with the head slightly elevated. Diet. Certain foods may trigger GERD symptoms in some people. This include greasy foods, spicy foods, chocolate, peppermint, coffee, foods containing tomato products, alcoholic drinks. If you are avoiding these types of food and still experience regular heartburn, it is important to visit a doctor as there may be other underlying issues causing the symptoms.